Hi friends, it's Kristen from Action Potential, and this video will explain what to expect when you come in for a pelvic examination, either for pain, incontinence, or prenatal or postpartum. When you come in for your evaluation, your therapist will spend some time talking about the history of your condition. That's an opportunity for you to share any experiences that you have, including doctor's visits or other forms of therapy that you've done to address that issue. We'll also review your medical history, your medications, as well as any other issues that might be contributing to your current situation. After that history taking, we'll do a brief look at your external body by looking at your posture, your flexibility, and your strength. That will give us an understanding of how your body moves and some additional limitations that might be contributing to your pelvic situation. The internal portion of the examination is the part that most people don't know what to expect, and so I'll explain that here. When you do the internal examination, you'll remove your clothes from the waist down and will be placed on a treatment table with a sheet covering your body. The therapist will look at your body from the outside to determine that everything is aligned as it should be, as well as to assess your skin. In addition, we will then, from the outside of the body, use our finger to press on certain muscles to determine if there's any sensitivity noted on the outside of the body. After that, with your permission, we'll take one finger and insert it into your vagina, where we'll test the flexibility of your vaginal opening, as well as look for any restrictions within that opening of the vagina. While here, we'll also ask you to do whatever you think a Kegel is. After performing that, we'll insert our finger just slightly further into the pelvic cavity, and we'll then assess the muscles from the inside by pressing on each muscle individually to see if there's any sensitivity or muscle tightness. After checking both sides, we'll also ask you to perform a Kegel here in the deep pelvic floor. Based on the performance for each of those components, we'll then explain to you what we think is the contributing factors that's leading towards your situation. And then most importantly, together we'll set a plan moving forward for how to proceed with your therapy sessions, as well as review any goals that you might have for therapy. Certainly, this can seem like an overwhelming process because it's something that many people don't associate with physical therapy, but I assure you that your therapist is very trained and professional in handling this situation and will be able to provide a comfortable experience as well as answer any questions that you might have. Thanks, and we look forward to having you join us.